Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, think about this for a second. For what, nearly 60 years now, the go-to blood test for checking your heart disease risk has been all about cholesterol levels.
Right, the standard lipid panel.
Exactly. But what if there's a simpler, maybe even more direct way, something that could pinpoint who's really at high risk, maybe even help prevent heart attacks better, all from, a single blood test?
Well, that's the really exciting idea coming out of some new research. It involves scientists from Chalmers University in Sweden and Harvard University over in the U.S.
Okay.
And their work suggests that measuring just two specific markers related to how fats get carried around in your blood might give a much more accurate picture of your individual heart risk compared to, well, the standard cholesterol test we use now.
A more accurate picture. Okay, I'm intrigued. Let's dive into this. So for this deep dive, we're looking at a couple of things. There's a health news article that flags this study, but we're also going right to the source.
The scientific paper itself.
Yeah, the actual peer-reviewed paper. It's called The Relative Importance of Particle Count, Type, and Size of Apolipoprotein B containing lipoproteins in the Development of Coronary Artery Disease. Bit of a mouthful, but it was published in the European Heart Journal.
A respected journal.
Definitely.
Yeah.
So our mission today is really to unpack why these researchers think this different approach could be such a big improvement for predicting your personal risk of heart disease down the line.
Yeah, and to really get why this new approach might be better, it helps to quickly recap the basics of the current thinking. I mean, we all know cholesterol is this sort of waxy stuff in our blood, right?
Right, essential for cells, but too much is bad news.
Exactly. It's vital, but if the levels get too high, you can start building up in your artery walls. It forms these things called plaques.
And those are the dangerous bits.
They can be. If a plaque breaks open, it can trigger a blood clot, and that's what leads to, heart attacks or strokes.
And you mentioned how fats get carried around. Cholesterol doesn't just float freely, does it?
No, absolutely not. It needs transport. Cholesterol and other fats, they're packaged into these particles called lipoproteins. Think of them like tiny delivery trucks cruising through your bloodstream.
Okay, little trucks carrying cholesterol.
Precisely. And there are different types of these lipoprotein trucks. Some of them contain a really important protein called apolipoprotein B. These are the ones often linked to bad cholesterol.
Why bad?
Because when you have too many of these apolipoprotein B trucks, they tend to drop off their cholesterol cargo in the artery walls, contributing to those plaques we talked about.
Gotcha. And then there's the flip side, the good cholesterol.
Right. That's carried by a different class of lipoproteins. These guys actually help remove excess cholesterol, kind of like garbage trucks taking it back to the liver to be dealt with. So they're protective.
So for decades, doctors have focused on measuring the amount of cholesterol in those different trucks, basically, to estimate risk. But this study is saying maybe we should be counting the trucks themselves, specifically the bad ones.
That's the core idea, really. It's a subtle but potentially crucial shift. We measure cholesterol levels, but the cholesterol itself needs its lipoprotein carrier, its truck, to actually get into the artery wall and cause problems.
Ah, okay.
So the researchers asked, if two people had the same total amount of bad cholesterol, but maybe the characteristics of their lipoprotein carriers, the size of the trucks, or the specific type are different, does that change their risk?
So are all the bad delivery trucks equally risky?
Kind of, yeah. Is a big truck riskier than a small one, even with the same total cargo measured? That's what they wanted to figure out.
Okay, so how did they tackle such a big question? Must have needed a lot of data.
Oh, absolutely. They used data from the United Kingdom Biobank. They analyzed blood samples from, get this, over 200,000 participants.
Wow, 200,000.
Yep. And crucially, none of these people had any known heart disease when they joined the study.
So a primary prevention group.
Exactly. They used some pretty advanced techniques to measure not just the cholesterol, but the actual number and the size of the different lipoprotein particles, especially focusing on those containing that apolipoprotein B protein.
And then they just waited.
Essentially, yes. They followed these individuals for up to 15 years.
15 years? That's long term.
It is. Long enough to see who unfortunately went on to develop heart attacks and to see which lipoprotein patterns were most strongly linked to that outcome.
And they checked their work.
They did. They validated their main findings in a completely separate study group in Sweden called the Simpler Study. Having that detailed blood analysis, the huge number of people, the long follow-up, and independent confirmation really strengthens their conclusions.
Okay, so after all that rigorous work, what was the big headline? What did they find?
The single most important finding was this. The total number of those bad cholesterol-carrying lipoproteins, which is directly measured by the level of apolipoprotein B in your blood, that number was the strongest predictor of heart disease risk.
Stronger than the standard cholesterol measurements.
Yes. Their analysis suggests that measuring apolipoprotein B gives a more accurate risk assessment than the usual tests. In fact, they estimated that standard cholesterol tests might actually underestimate the risk in about 1 out of every 12 people.
1 in 12. That sounds significant.
It really is, especially when you consider that, sadly, a lot of first-time heart attacks or cardiovascular events are fatal. Getting the risk assessment right, especially early on, could literally save lives.
Okay, so apolipoprotein B is the key number. Were there any other important markers that came out of this?
Yes, there was another one they highlighted. It's another type of bad cholesterol carrier called lipoprotein. They found it's also really important to measure.
Lipoprotein A, what's special about that one?
What's really interesting is that your levels of lipoprotein are largely set by your genes. It's mostly inherited.
Ah, so not much influenced by lifestyle.
Much less so than other cholesterol markers. Now, for most people, lipoprotein A only makes up a small part of their total bad cholesterol carriers. But some individuals inherit genes that give them very high levels.
And that increases their risk substantially.
Significantly, yes. So the researchers strongly recommend testing for both apolipoprotein B and lipoprotein A to get the full picture of your risk from these fatty particles.
What about all those different sizes and types of the other bad lipoproteins? Did that turn out to matter much in the end?
You know, that was one of the more surprising findings. Once they accounted for the total number of particles that apolipoprotein B number, things like the size or the specific subtype of the particle, didn't seem to add much extra information about the overall risk.
So count the trucks. Don't worry so much if they're pickups or semis, basically.
That seems to be the main message for overall risk prediction, yeah. Although they did note something interesting. Particle for particle, the really tiny ones, the very low-density lipoproteins, seemed a bit riskier than the more common low-density ones.
But there are just way more of the low-density ones.
Exactly. So even if the tiny ones are slightly more potent individually, the sheer abundance of the low-density lipoprotein particles means they contribute more to the overall risk burden for most people.
Okay, this is starting to paint a clearer picture. So thinking about the real world, if these findings catch on, what are the implications? What could change?
Well, the potential impact is huge. The researchers themselves suggest that measuring the apolipoprotein B particle count could potentially replace the standard cholesterol tests we use worldwide.
Replace them for everyone in research and regular checkups.
That's the potential they see down the road, yes, for assessing heart disease risk.
Then what does that mean for, for you listening, for the average person getting a checkup?
It could mean getting a much sharper, more accurate understanding of your personal risk of developing heart disease.
And that would lead to?
Hopefully to earlier and more tailored prevention strategies. Maybe it's specific lifestyle advice. Maybe it's starting medication sooner if your particle count is high. Even if your standard cholesterol looks okay, it allows for more personalized management.
Which, going back to that 1 in 12 number, could prevent some of those potentially fatal first events.
Precisely. Better early identification is key.
And that lipoprotein A finding seems crucial too, especially for people who might have that genetic predisposition.
Absolutely. If you know you have genetically high lipoprotein, that's powerful information. It's a risk factor. You can't change much with diet or exercise, so it might prompt more aggressive management of other risk factors or closer monitoring. It empowers you and your doctor.
And it sounds like these tests, apolipoprotein B and lipoprotein, they aren't some futuristic thing. They're available now.
Yes, that's a really important practical point the researchers made. These blood tests are already commercially available. They can be done now. And they're apparently not prohibitively expensive or complicated to add to routine checks.
Okay, that's promising. But, every study has its limits. We need to be balanced. What are the important caveats here? What should we keep in mind?
Right, definitely important. First off, this was an observational study. That means it found strong links, strong associations between these lipoprotein markers and heart disease risk. But it can't definitively prove cause and effect.
So correlation, not necessarily causation.
Exactly. There's always a chance some other factor they didn't measure could be involved, even though they tried very hard to adjust for known risks like smoking, diabetes, blood pressure, and so on.
Okay, what else?
Well, the study population, the UK Biobank folks, they tend to be, on average, a bit healthier and perhaps more health conscious than the general population. So the results might not perfectly mirror what you'd see across everyone.
And demographics.
Yes, the participants were overwhelmingly of white European ancestry. So we definitely need more research to confirm these findings hold true in people from different racial and ethnic backgrounds. That's crucial.
Anything else?
The study focused on primary prevention people without known heart disease or who weren't already on cholesterol-lowering drugs. We need more studies to see if measuring apolipoprotein B and lipoprotein A is equally useful for people who already have heart disease or are being treated.
Makes sense.
And finally, there were a couple of technical points. The specific lab method they used, nuclear magnetic resonance, didn't directly count lipoprotein particles. And different lab methods can sometimes give slightly different results for things like lipoprotein size. Also, the UK Biobank samples weren't fasting samples.
Oh, does that matter? We're usually told to fast for cholesterol tests.
Traditionally, yes, but non-fasting samples are becoming more common. And importantly, they did replicate their key findings in that Swedish study where people did fast, which gives us more confidence that fasting status wasn't a major issue here.
Okay, good to know. So putting it all together, what did the actual researchers, the authors, take away from their own work?
Well, Jakub Morse, who is the lead author, really stressed that this was the biggest study of its kind looking at these different lipoprotein families. He basically said their data clearly shows apolipoprotein B is the best single marker when you're testing for risk.
Better than standard cholesterol for a good chunk of people.
Yes, offering that more accurate test for, as we said, maybe 1 in 12 patients whose risk might otherwise be missed or underestimated.
And the other author you mentioned earlier, Clemens Wittenbecher.
Right, he focused more on the future implications. He echoed the idea that apolipoprotein B particle count could really become the new global standard, replacing routine cholesterol testing for risk assessment.
Both in labs and clinics.
Yes. And he also hammered home the importance of testing for lipoprotein A alongside apolipoprotein B to get that complete picture of risk related to fats and artery hardening or atherosclerosis. And again, he emphasized that these tests are ready to go, available, affordable, and implementable now.
So the consensus from the study team seems pretty clear.
Yeah, the bottom line from their perspective is that if you want the most accurate assessment of someone's total risk from artery clogging fats for prevention purposes, you should look at both their apolipoprotein B particle count and their lipoprotein A level.
Wow. Okay, this has been incredibly insightful. It really does challenge the way we've thought about cholesterol and heart risk for so long. So thinking about all this, maybe the question for you listening is, what questions does this raise for you about how your own risk is being checked?
Is simply looking at your cholesterol numbers enough anymore based on this evidence?
It's definitely food for thought. Perhaps it's worth doing a little more reading on apolipoprotein B and lipoprotein A yourself.
And maybe, just maybe, it's something worth bringing up with your doctor or healthcare provider at your next checkup, discussing whether these tests might be relevant for you.
Absolutely. Because ultimately, understanding these finer details, these lipoprotein carriers, it could be a really powerful step in taking more proactive, more informed control of your own heart health.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.